Continuing with Objective 3, now we're going to define, pronounce, and spell disease and disorder terms related to the musculoskeletal system. And we will start with the terms built from word parts. And again, there's quite a few terms in this chapter, so again, it's just going to take a little bit more time to learn them. So let's start out with ankylosis, abnormal condition of stiffness, often referring to fusion of a joint, such as a result of chronic rheumatoid arthritis. Arthritis, inflammation of a joint. The most common forms of arthritis are osteoarthritis and rheumatoid arthritis. Bursitis, inflammation of a bursa. Chondromalacia, softening of cartilage. Craniochesis, fissure or split of the cranium, which is congenital, so they're born with it. Discitis, inflammation of a intervertebral disc, also spelled with a C instead of a K. Fibromyalgia, pain in the fibrous tissues and muscles, a common condition characterized by widespread pain and stiffness of muscles, fatigue, and disturbed sleep. Kyphosis, abnormal condition of a hump in the thoracic spine, also called hunchback or humpback. Lordosis, abnormal condition of bending forward in the lumbar spine, also called swayback. Maxillitis, inflammation of the maxilla. Meniscitis, inflammation of a meniscus. Myasthenia, muscle weakness. Myeloma, tumor of the bone marrow, usually malignant. Osteitis, inflammation of bone. Osteoarthritis, inflammation of the bone and joint. Osteochondritis, inflammation of bone and cartilage. Osteofibroma, tumor of bone and fibrous tissue, benign. Osteomalacia, softening of bone. Osteomyelitis, inflammation of bone and bone marrow caused by bacterial infection. Osteopenia, abnormal reduction of bone mass caused by inadequate replacement of bone loss to normal bone lysis and can lead to osteoporosis. Osteopetrosis, abnormal condition of stone-like bones, very dense bones caused by defective reabsorption of bone. Osteosarcoma, malignant tumor of the bone. Polymyositis, inflammation of many muscles. Rachis, fissure or split of the vertebral column, congenital, so they're born with it, also called spina bifida. Rhabdomyolysis, dissolution of striated muscle caused by trauma, extreme exertion, or drug toxicity. In severe cases, renal failure can result. Sarcopenia, abnormal reduction of connective tissue such as loss of skeletal muscle mass in the elderly. Scoliosis, abnormal condition of lateral curved spine. Spondyloarthritis, inflammation of the vertebral joints, also called spondyloarthritis. Spondylosis, abnormal condition of the vertebrae, a general term used to describe changes to the spine from osteoarthritis and ankylosis. Synoviosarcoma, malignant tumor of the synovial membrane. Tendinitis, inflammation of a tendon, also spelled tendinitis with an O, not an I. Tenosynovitis, inflammation of the tendon and synovial membrane. So here is just a picture of a normal knee joint. Here's one with osteoarthritis. And then here's one with rheumatoid arthritis. So let's look at the diseases not built from word parts. Ankylosing spondylitis, form of arthritis that first affects the spine and adjacent structures, and that as it progresses causes a forward bend of the spine. Bunion, abnormal prominence of the joint at the base of the great toe, the metatarsal phalangeal joint. It is a common problem, often hereditary or caused by poorly fitted shoes. Carpal tunnel syndrome, common nerve entrapment disorder of the wrist caused by compression of the medial nerve. Symptoms include pain and tingling in portions of the hand and fingers. Colles fracture, type of wrist fracture. The fracture is at the distal end of the radius, the distal fragment being displaced backward. Exostosis, abnormal benign growth at the surface of a bone, also called spur. Fracture is a broken bone. Gout, disease in which an excessive amount of uric acid in the blood causes sodium urate crystals or tophi to be deposited in the joints, producing arthritis. The great toe is frequently affected. Herniated disc, rupture of the intervertebral disc cartilage, which allows the contents to protrude through it, putting pressure on the spinal nerve roots. Lyme disease, infection caused by a bite from a deer tick infected by Borrelia. I'm not even going to try to pronounce it, I apologize. This bacterium provokes an immune response in the body, the symptoms of which can mimic several musculoskeletal diseases. Patients may experience fever, headache, and joint pain. A rash target lesion may initially arise at the site of the tick bite. Lyme disease was first reported in Lyme, Connecticut in 1975. Muscular dystrophy, group of hereditary diseases characterized by degeneration of muscle and weakness. Myasthenia gravis, chronic disease characterized by muscle weakness and thought to be caused by a defect in the transmission of impulses from nerve to muscle cell. The face, larynx, and throat are frequently affected. No true paralysis of the muscle exists. Osteoporosis, abnormal loss of bone density that may lead to an increase in fractures of the ribs, thoracic and lumbar vertebrae, hips, and wrists after slight trauma, occurs predominantly in postmenopausal women. Plantar fasciitis, inflammation of plantar fascia, connective tissue of the sole of the foot due to repetitive injury, common cause of heel pain. Rheumatoid arthritis, chronic systemic disease characterized by autoimmune inflammatory changes in the connective tissue throughout the body. Spinal stenosis, narrowing of the spinal canal with compression of the nerve roots. The condition is either congenital or due to spinal degeneration. Symptoms are pain radiating to the thigh or lower legs and numbness or tingling to the lower extremities. Spondylolisthesis, forward slipping of one vertebrae over another. So let's just answer a few more questions here. This is an abnormal reduction of bone mass, but not to the extent of osteoporosis. So again, you can always look back at your definitions, and it should be letter B, osteopenia. This is when the patient has excessive uric acid, and it may cause which disease, and that's going to be gout. This provokes an autoimmune response that can mimic several musculoskeletal diseases. So it was caused by a tick, and that's that rash that they're talking about, and so that is Lyme disease. The medical term that means abnormal loss of density that may lead to an increase in fractures. And again, also very common in postmenopausal women. So that's going to be letter B for osteoporosis. And so terms known by other names, there were several of these in this chapter. So just as a review, kyphosis also means hunchback or humpback, lordosis, swayback. And I think we've gone over all of these within the recording, so I'm not going to go over them again. Name the abnormal curve and directional terms used to identify the artist's depiction and radiograph of the lumbar spine. So you can see how it's curved, and that's scoliosis. Here is a picture of carpal tunnel syndrome. And it's basically asking what is the effective nerve of carpal tunnel syndrome, and that's going to be the median nerve. Which is the effective bone of a Colles fracture? That should be fracture, I apologize. What is the anatomic location of the fracture in the bone? And so that's going to be the distal end of the radius. And that will end this recording.